Good morning to one and all. I'm Dr. Priyanka, and today we are going to discuss dye systems and materials. Okay, coming to the learning outcomes. So, first we'll have to define the dye, outline the dye materials and selection criteria, and compare various dye systems and provide advantages, disadvantages, indications for each category. Okay, so starting with the definition. Uh, Starting with the working class definition. Okay, so the whole thing is known as a working cast. Okay, and the individual pieces that we cut are known as die. Okay, so working die is the replica of a prepared teeth, ridge areas, and other parts of a dental arch. Okay, this definition is according to Rosenstiel. Okay, that is the standard textbook of FPD. Coming to the definition of a die, die is a positive reproduction of a prepared teeth and consists of suitable hard substance of sufficient accuracy. Okay, so that is improved stone, metal, or resin. Okay, so basically, this individual structure is known as a die. Requirement of a working die. So, working cast. So, as a whole, the whole cast should be able to reproduce both prepared and unprepared tooth surfaces, right? Should be able to at least show us. And unprepared teeth adjacent to preparation must be free of voids, okay? So, the working cast should be poured properly and the die should be clearly visible. The finish lines and all the structure should be, the prepared tooth should be properly visible. So if you take a good impression, the whole thing will be reproduced properly. The anterior teeth involved in anterior guidance and occlusal surface of all teeth should allow precise articulation with the opposing teeth. So again, these things will be achieved only if you take a proper impression and you reproduce a proper cast. Okay, so then you'll be able to incise it, you'll be able to occlude it if required to be occluded with the opposing arch occlusion. The relevant soft tissue should be covered, including the edentulous spaces and contours of the residual ridge that will be involved in the fixed partial denture. So everything should be taken into account. Okay, the unprepared teeth, any structures which are there, any abnormalities with the other teeth, anything. So usually, yes, we do prosthodontics at the end of all the treatments. So basically all the teeth should be restored before doing this. Okay, so even though anything is there, it has to be completely recorded. Requirements of a die preparation. So this is an individual structure is known as a die. Okay, all surfaces must be accurately duplicated and no bubbles or voids should be accepted. So you have to apply proper pouring techniques. Okay, all the details of prepared tooth should be reproduced. The unprepared tooth surface immediately cervical to finish line should be accurately produced in order to allow the technicians to prepare accurate finish line in wax patterns. Okay, so we do contouring of the die, which I'll be talking about. You see there is no contour here. Below the finish line, so a lab technician can see the finish line properly and a proper die can be formed. Okay, we do it for that reason. Accurate access to margins are necessary. Okay, so everything should look clear and should be visible. Okay, all right, coming to basic requirements of die materials, it should have accuracy and dimensional stability. It should have smooth hard surface which should not easily abrade. It should be compatible with impression material. It should have high strength. There should be a color contrast. It has to be economical. should be able to manipulate easily and fast, should have ability to reproduce fine details and sharp margins. Okay, so these are the requirements of dye materials which we are using. Okay, so dye materials which are used for fabrication, there are many dye materials which we use. So gypsum products, type 4, type 5 divestments, also amalgam used for making dyes, cements, okay, that is the silicophosphate cements, polymers are used, epoxy resins, self-curing acrylics, electrode deposition of metals are also used as a copper plated, silver plated, metal sprayed dyes, flexible dye materials, refractory materials for dye preparation. Okay, so all these are used, commonly used are the gypsum products. Okay, coming to dye systems. So a working cast with a separate dye and a working cast with a removable dye. Okay, so basically, um, yeah, yeah. So we can separate it out, and usually we have systems which consist of dyes which can come out in the hand, and it can be prepared even easily, guys. Okay, so working cast with a separate dye. So two casts are poured from a single impression, and one cast is sectioned and used as a dye. The other is not sectioned and is used as a working cast. Okay, so you have two models. One is a working cast and one is for the dye preparation. So you can separate it. The wax pattern is prepared on the dye and later transferred to the working cast. Okay, so in a removable dye, you can remove the dye, make a wax pattern, you can put it back in the cast. Okay, or pouring an elastomeric full arch impression twice. First cast is used for fabrication of a dye. Okay, so either you pour the impression 2 times and then you do it, or you uh make a dye and then you make another dye. Okay, it's the same thing. We make a cast and then you make another cast with dye and without the dye. Advantage and disadvantage of this technique is it is simple, slightly more accurate, easy to obtain contours, intact gingiva, no special equipment required, no error of seating. Okay. Disadvantage is the wax pattern may get distorted while transferring. Yes, it from the dye to the cast. Proximal margins tend to get over contoured sometimes. Okay. So how do we prepare dye? So a dye is first trimmed on the model. Okay. So if you have a small model, or if you want to take only one section of the model, you trim it in the trimmer. In the second picture, you see a properly trimmed die handle is slightly larger in diameter than the preparation. This is known as a die handle. This is the prepared teeth. This is the margin. Okay. And this is the handle. Okay. This is the contour which we do, and this is the prepared tooth, and that is the margin. Okay, so it has to be 1 inch long. A die is trimmed with an acrylic burr to form contour. So this is what they're doing now. Okay, so it is trimmed. This is just so that the margin is clearly visible. Okay, after that, the preparation finish line is marked with a red color pencil, so it is clearly visible. You can see this is the margin, and then the die hardener is coated on the die. Okay, so um, it can be die hardening agent, cyanoacrylate, or acrylic resin lacquer, can be applied to the finish line area of the die to prevent abrasion by wax instruments during the fabrication of the wax pattern. Okay, so you want to preserve it as it is. Advantages is it is simplest means of fabricating a working cast. It also keeps the relationship of abutment fixed and immovable. This method is more accurate as it allows the orienting the preparation model to each other, which is considered important step in minimizing cost adjustment. So it can be oriented back, and it will actually minimize also the air margin which is present at the end. Gingival tissue and other landmarks are also intact. It's easier to obtain the physiological harmony, restoration contours when fabrication of wax patterns. Okay. So disadvantages is that the procedure is a little difficult. Yes, you can encounter poorly seating dies and dolls. Yes, that happens sometimes. Difficulty in sawing the dye out of the cast. Yes, it is. Interproximal margins can easily be damaged. Not really, but yes, sometimes if you're not careful, it happens, guys. Okay, so requirements of a removable dye system. Okay, so we'll be coming to the removable dye systems, guys. Okay, so first of all, talking about the requirements. So before we are talking about the dyes which were fixed, okay, which we were not able to remove, the dyes must return to their exact original position. The dye must remain stable even when inverted. The cast containing the dyes must easily be able to mount on an articulator. Okay, so working cast with the removable dye, guys. Okay, so we have a pre-pour and a post-pour technique. So in pre-pour, what you do is during the pouring, you put the dowel pins inside. You call these dowel pins, and you are secured by pins and clips. Okay, and then you pour one layer. You put a separating media, and then you pour another layer. Here you make holes, you put the dowel pin in one layer, and then you put maybe a plastic sleeve or wax, put a separating media, and then you pour another layer, and then you do sewing of the dye. Okay, so first coming to the pre-pour, most of these devices can be oriented in the impression before it is even poured. Post-pour technique is attached to the underside of the cast that's already been poured, guys. Okay, so now presenting you the four important systems, guys. This is important, okay? Straight dowel pin, curved dowel pin, Pinex system, and Dialog system, okay? So in dowel pin, you also have like a bifurcated bi-pin system. So this is a single pin, this is a curved pin. Here you can have one head and two bifurcations, okay? I will show you in the slides. Know this, guys. Straight dowel pin, this is just a straight dowel pin, okay, which is attached on the die. So this is the first pour, this is the second pour. You have separated, put a separating media, put a sleeve, okay, this goes in the cast. This is visible. You can put a wax down or a sleeve, and you can take it out, contour, and put it back. Okay, this is straight, that's why it's known as a straight dowel pin. Okay, so dowel pins are positioned over the impressions by bobby pins, basically. So yes, we secured by a pin. We put some clips, sharp clips, and we secured, and then we can pour the one layer and then safely remove this. Put a pour a after it sets, you paint a separating media and you pour one more layer, guys. Okay, and yes, you have to put a little bit of wax under this area. Okay, so it's easier. Paper clips are added to non-removable parts, okay, like this. Okay, the non-removable, but just to give it more retention and strength for the second pour, guys. Okay, so it's like making retention glue. Okay, the stone around the dolphin pins are lubricated. The a filter is placed in the lingual surface and base is poured. Okay, so now we are painting the spacer or uh, separating media. When it is set, base is trimmed to remove the excess. Okay, and you can see that a wax is put at the end of the pins. Okay, wax at the end of the dowel pins are located and removed. All right, so after pouring, you can see that sometimes you're able to see the wax hanging out. So, or you leave it like that. So you just take it out and then you can just push it out. But it's not going to come out now, guys. You have to saw it, okay? You have to section the cast, okay? Yeah, there you go. So dyes are separated from the rest of the cast with a fine saw. So this is an instrument which we use, guys, okay? So there's a very thin small saw and you section the pontic and the abutment area, okay? Yeah, till the first base. Okay, and you can see when you pour it into two different colors, you'll be able to happily appreciate it, guys. Okay, I mean, evidently, yeah, sorry. So you can just saw it out and then it should be easily able to be taken. Okay, all right. After the dies have been separated from the cast, the ends of the doll are uh, taped to loosen the die from the cast. Okay, so you can just um, tap it and it'll just come out, guys, as a die in separate. So it'll come out as one, two, three parts. Okay, all right. Yeah. Okay, so now when you have a single die coming out, you can trim below the margin to avoid possible damage to the margin. So that's why you do the contouring. Okay, all right? Yeah. And then you mark it with the red pencil. So going back to our previous slides, which I covered. Yeah, with an acrylic trimmer. Okay, so die are reseated into the cast. One, two, three, guys. This is, we can just push it up. Okay. Coming to the pre-pour technique, guys. So in short, this is known as a doll pin, right, guys? So doll pin is positioned within the impression using a sticky wax. First pour is poured up to the level of the alveolar ridge. Separating media is applied. After the cast is set, the die is sectioned. Okay, so second pour, separating media in the middle. After the cast is set, the dies are sectioned by placing vertical sections in the interproximal region using a die sectioner. Since the separating media was applied before pouring the second half of the cast, the dies can be easily separated with the vertical section alone. Okay, so don't worry, it can come out easily after you section it, guys. Okay, coming to curved dolphins. So just now we covered straight dolphins and a pre-pour technique. Okay, so this is just curved. That's the difference, guys. This will be like coming out of the model. Yeah, it's funny, but that's how it looks. Curved dolls can be incorporated into a working cast by fixing the dolls to the impression before it is poured, or by cementing the dolls into um, holes drilled in a previously poured cast. Okay, so either it can be used in a pre-pour or a post-pour technique. Okay, all right, yeah. This is like a cross section, guys, showing a curved doll to the impression. That is like the pre-pour method. Okay, so this is an impression. Okay, first pour impression. This is a curved doll pin. Okay, so just remember that this stone is poured covering the heads of the doll and around 1 to 2 mm of the body of the doll. Okay, also the body. All right, so you also have to place a positioning bar here just to make it straight because it's a curved thing, right? So it's a little more difficult to orient. Then you place these pins. Okay, and then you can do a pre-pour technique. So depressions are made about 2.5 mm deep on either side of the dolls uh, in the two large segments. Okay, so one, two, three, four. So at least 2 mm deep, and you have to separate it into two. Okay, of the cast that will carry the unprepared teeth. Okay, and then the broken lines indicate where the cast has to be sectioned, guys. Okay, so just for stability and for anchorage, for retention, you're making these big holes. Okay, all right, so you can pour it and have that fixture in the second pour, and you can see these are coming out. It's like seriously coming out. Okay, when you box the impression, they're kind of piercing out. They're curved. Yeah. Then layer of petroleum or any of the separating media is applied on the stone and the doll. Yeah, here, very clear, right? And then you box the first impression and then you pour the second impression on top. Okay, so boxing wax is placed around the impression with the tips of the doll sticking through. Because they are curved, they have no place to go, they have to stick out. The complete cast is sword again. Okay, so again you use a saw and you have to cut and section one, two, three, four. Okay, a segment is removed by pressing on the exposed tip of the. So it's really easy. Here it's a little bit more easy, but yes, the orientation a little difficult. So just have to push it out from outside, then pressure. You can see it's going to just jump out like that. Yeah. All right, coming to the Pinex system, guys. So Pinex system is a reverse drill system is used to create a master cast with dies that can be removed and replaced repeatedly with greater precision. Okay, so this is the one of the best systems which we used to I used it, yes guys. So and usually used, so the impression is poured without positioning and attaching the all pins beforehand. The machine accurately drills parallel holes from the underside of the trimmed cast. So this is the biggest difference here. Okay. So now you'll see how we do it. Okay. So the cast poured allows allowed to set and the cast trimmed on the model. Okay. We pour we pour the impression normally. At least it should be like it should have a proper height, and then it is trimmed nicely. Okay, and yes, you have to cut out even the palette if it's there. Okay, lingual surface, everything. Okay, so at least after trimming it has to be at least 15 mm. Okay, so cast should be at least 15 mm thick from the cervical portion of the teeth, and the periphery of the cast is trimmed on the model trimmer. Okay, everything, this is the lathe and it's trimmed nicely. Don't trim out the teeth. Okay, all right. Okay, it has to have that much thickness, guys. The palate and the tongue area is trimmed out also, guys. Okay, made space. Okay, so this is the main machine which is used. Okay, so this is a Pinex system. It's a machine which uses like this is the light beam director, guys. Okay, so light, exactly like my pointer, right? You see my laser pointer, exactly the beam looks like that, and you can see it on the cast. Okay, and then you just have to push it. This platform is a working table. Okay, here it has a small drill hole. Okay, there's a handle bar down. Okay, and of course below there is a motor housing. It can look as a round or in a square form, a rectangle, like a square form or a round form. You just have to push it. Okay, so like a spring, it will just go down, and the light will direct and will go down, and it's going to pierce hole under the prepared teeth. Okay, so you can place two holes here. If like if, in my time I used to use a bi pin. Okay, with one head. Okay, so one two, one two, one two. Okay, otherwise one two three. Okay, like that. So this is the main system used in the Pinex, which makes it different from all the others. The accuracy, yes guys, there you go, you can see, right, the light beam, and you just have to push it. Okay, yeah, there. So in short, if you see it look like the light beams, it look one two one two one two. Okay, on both the occlusal surfaces, guys. Okay, pontic and the abutment areas, guys. Okay, prepared to this place under the illuminated dot and the thumb used to stabilize the cast, and you just press through. It's like a spring, and under the cast it'll make holes. Now that those are the holes which are drilled. When you turn it around, you see the debris are removed from the pinhole, and the pinholes are refined with the hand reamer or just brushed out. Okay, and you can see. So if you're using like a bi-pin, guys, so bi-pin has one, two, and like a big head. Okay, so it's like a bifurcated head with one big head. Okay, bifurcated pin. So that's what I used to use in my times. So, and for the stability, you have to put it in other places as well, guys. Okay, all right. But you'll be only sectioning and removing this portion. Yeah. Now, what you have to do, you have to put cyanoacrylate cement is placed on the pins prior to cementing. It tips. Otherwise, it's going to just come out, guys. Yeah. So, that tip has to be secured properly, and the shorter pins will go first. So one will usually be shorter than the other one, okay? And it will also have like a small sleeve. You can see these are the sleeves, guys. Yeah, yeah, these are the sleeves which are placed. So it's for easy removal. Yeah, so you don't have to place wax. So sleeves are placed on the pins, and the bottom of the cast is lightly coated with a petroleum jelly or any or separating media. Okay, all right. So here, and then you can go ahead, put it in a base former, and just pour a layer of base. Yeah. Okay. The ends of the short pins are blocked with wax. Okay. So even after putting the sleeve, guys, there could be a little bit hole exactly where I'm pointing right now from my laser pointer. So there you need to fill in a little bit of wax, and utility wax is placed on the ends of the long pins. All right. You don't need to put such a big chunk. You can just put a little bit. Yeah. The palate or tongue fillers are made of boxing wax and boxed around the cast. Okay, so you can just maybe box the wax. That's also okay because if you use a base form, it might be too thin. So you can just box the impression and then pour another base. Okay, the second pour. All right, guys. So this is the um, boxing impression. The stone is vibrated around the base of the pins, and the base former is filled with stone, and the cast is seated in the base former. Okay, so once you have a proper base, if you still want it placed in a base former, you can also put it in the base former and just place it. But if the base form is not deep enough, you can just box the impression and pour it evenly. All right, but yes, it should be without bubbles, guys. So here, so first you can just put a little bit material here, and then you pour it on top. So first securing these by the cement, okay? And you can see these wax chunks, yeah, sleeves and the wax. Okay, now again coming to dissectioning. So this will remain same, guys, for all the procedures. The saw cuts are pre-marked with pencil and then section. So you can just happily mark it 1, 2, 3, 4. 1, 2, 3, 4. Okay, and just cut it. So you can see they're separated by two colors. A large condenser can be used to loosen the dies. So you can just, push the dies out. Okay, you'll be able to see at the end of the pour, there will be like wax sticking. So you know that that is the end of the second pour. So you can just push that wax and the die will come out. Okay. Okay, coming to the last system, that is a dialog tray system. This is a very advanced system. A snap apart plastic tray with internal orienting grooves notches can also be used to reassemble the working cast and dies. Okay, so it's already sectioned, guys, and it is placed. Advantage of a dialogging system is extremely accurate. It has reusable trays, no pins are required, impression is poured once. Advantage is that yes, it is time consuming. Um, must cast trimming to accommodate wide R. So yes, cast trimming is required. Index are small and can fracture, guys. That's how you do it. You just pour the impression. Okay, all right, and you place it on top of the space. All right, and this is how it looks like, guys. You tap it, and but still you need to saw the whole thing, right, wherever required, guys. So you have to do sectioning, sawing of it, and you can separate the dies like that, right? Okay, and that's how it looks like. So this is like a detachable tray which is present. Okay, you just section it and you just take it out. Everything will be sectioned and you can put it back together like that. So that is how it looks like. Yeah, you just section it out and put it back, guys. So it's like a section tray, but yes, you do have to section it wherever required. Like here, it's like a full mouth rehab case, I guess. All the teeth have been prepared. Okay, so usually it makes more sense to use the system for a full mouth case, as you have done tooth preparation for all the teeth, and then only it makes sense. It doesn't really make sense to do it for two or three teeth. Yeah. that system works. Okay, so summarizing, so you should be able to differentiate between working cast and die materials, die preparations, working cast with separate die, working cast with removable dies, and the die systems which we use: straight dowel pin, curved dowel pin, Pinex system, and Dialog system. Okay. Okay, guys, thank you so much for patient listening. The standard textbooks remain Rosenstiel and Schillenberg for FPD, guys. Please refer to them, refer to this presentation, refer to notes. For any questions, I'm available in the Polyclinic 3, in the Prosto department. Please come and ask questions if you have any. Thank you.